Hi, Dr. Fonseca here from Mayo Clinic. I'm here to tell you about some changes that we are doing with regards to how we test abnormal proteins for multiple myeloma and the changes you will see in your patient portal. And I want to take a minute to explain to you how this is working and what you will see in the computer. Um, Main changes is so we're doing a test now called mass spec. Sometimes you'll see people that refer to it either, in their language or in the papers as MALDI or mass fix. We have done this for some time, which is what you see here on the far right part of the slide here. But before we didn't have the ability to quantify the protein. So the change is what you're seeing here now. So this test is more precise, it's more accurate in telling us the real concentration of abnormal proteins, and can discern, for instance, the protein that shows up in your blood as part of the treatment with daratumumab or the original abnormal protein related to your disease. So in the portal, you'll see the results come under M-protein, okay? The first line where it says therapeutic antibody, if a patient is getting treatment, sometimes we'll put a comment like the patient is getting daratumumab or isatuximab. Then when you see M-protein, where my pointer is here, that is a concentration. That is equivalent to what you used to get in the M-spec, and they're the same units. So you can replace one for the other, okay? Now, part of the changes, this is more precise, particularly at lower concentrations, and I'll show you some examples. For patients who have low concentration proteins, the number with this new test tends to be lower. And the reason for that is because this new test can separate the normal proteins from our blood from the truly abnormal ones. I won't go into all the details how that's done, but this is a more precise assessment of that. Now, it's more sensitive because it can go down to lower levels. With the previous test, we usually measured about down to 0.2 or 0.3. With this one, we can go down to as low as 0.01. So it's somewhere between 10 to 30 times more sensitive than the previous test. Now, the next line, it says positive. Positive, it means they find something. Sometimes it means that they find the original protein. Sometimes they means that it's positive because there's a protein abnormality, such as could be someone who's getting treatment with daratumumab, with your Faspro injections, for instance. Now, in this case, you see after M protein, there's the letter G and L. That tells us that the protein is IgG lambda. So in a patient who's IgG kappa would be GK or AK for A kappa and so forth. And then underneath there is a comment that we can expand that the pathologist puts with the interpretation of the results. So it's more precise, it's more sensitive, can go to a lower level, okay? We will not be doing this test anymore, so we won't be doing the serum protein electrophoresis. And sometimes there is a secondary test we did that's called immunofixation. We won't be doing that test anymore. So you're accustomed to, seeing the M spike. You have the result here. All of this is going away. So you won't get the alpha-1, alpha-2, beta results. We're not doing that anymore. And again, keep in mind, the results we get with the previous test I showed you, the mass spec is more precise and is more specific. Some patients may still have this in their treatment plans or previous orders, so there might be a little bit of overlap. But as we get into the future, we won't be doing this test anymore. Now, this won't change the light chain. So as you know, we measure the kappa and the lambda free light chain because that's important for us to monitor the myeloma. So the units are the same, the results are the same. The next set of lines you see there are the immunoglobulins, the IgG, the IgA, and the IgM. The results won't change. I apologize because during this time of transition, some of you will have two results for the same day. It's still the same as we move. They're testing it twice right now, but as we go into the future, you will just see the standard one line. For patients, it's very important to know that one of the main reasons we do this too as well is to monitor for the IgG. Patients who have low concentrations of IgG, to us that means under 400, have a greater risk of infection. So you will often hear from us that if we see the IgG, going on there and being sustained under 400, that we will recommend that we replace the immunoglobulins. And, we'll talk about that with you if the time comes. Let me show you a couple of examples of how this test is different. These are practical cases. These are real cases. So this is a patient that completed a transplant. And after the transplant, the patient was thought to have an M spike of 0.5. If the numbers don't mean much to you, it means that, we can easily still detect an abnormal protein. And for a number of reasons, I thought this was higher than what it should be. Now, on the same day, the new test now tells us that this comes out at 0.062. So it's much lower concentration, more consistent with what we expected. So again, I'll repeat it. Trust the results of this test, and that's why we're moving forward. The concentration, when you have low-level abnormal proteins, will tend to be even lower, okay? Important for you to know, we're not drawing more blood on patients. The same amount of blood is just how we report these results. And here's another example. This is a patient with Waldenstrom's. The patient was getting therapy. The patient was worried because we still found an abnormal protein that measured, apparently it was supposed to be 0.3. But once more, on the same day, we do the testing, and it's much lower, 0.018. So we're obviously happy with those results. We like to see lower numbers. The lower the concentration, the better it is, because that means the treatment is working better. So I hope you enjoy this, and this is helpful for you to interpret the proteins, and feel free to share this link with family members or other advocates that are helping you in your care. Thank you.